We're at the IAS meeting, and we're in Paris with Baeten from the University of Washington, and we've been reminiscing over the history of various aspects of HIV and so forth, and we talked a little bit about this in advance. It is good to remember history because we learn from it, and that's what causes us to do what we do and get where we go, and we're there now. So tell us a little about what you want to remember as how we started in this prevention area.
We're just in such an exciting and new place with prevention, with vigor and hope in a way that I don't think we felt for a couple decades now. I think back to my memories of like the late 80s, early 90s, and what prevention looked like then. And what now we can talk about in terms of prevention and prevention options for people. At this meeting, there's a lot of discussion about PrEP for prevention, as well as, of course, treatment, and how those two are coming together with, undetectable is uninfectious, U equals U, and the great examples now from Australia, from the United Kingdom, from the United States, from places in Africa about the ability to scale up PrEP. And when you scale up PrEP, how people are not becoming infected. And how that changes how people are thinking about their life, their sex life, their interactions with other people. There are great quotes now from people taking PrEP, for example, saying, I have never, in my entire lifetime, in 30 years, had sex in a way that I wasn't filled with fear. And how amazing that is. And that's not, you don't think about those things when you're a scientist developing a pill, or when you're doing the statistics for a public health trial. But when that's what resonates with people, what a great place we are in, and how great it is to be able to be responsive to what really motivates people. I think we've got an opportunity with HIV prevention now, with treatment and with PrEP and with all kinds of our other strategies together to make this huge dent in the epidemic, and to do it in a way where people are going to be really engaged in it, because we're responding to what's important in people's lives.
Yeah, there's so much happening at this conference that really does get us to that point. And we many years we said treatment is prevention, treatment as prevention. Julio Montana, as you know, was a great advocate and activist physician, and so it is an important moment. So, but you can remember the dark days, and there are a number of us here at the conference that are, don't want to do that, but when we do, it's riveting. I mean, we think about those that have been lost, and now we're at a point where, like you say, we're just, not forgetting that, but we're feeling engaged and feeling in a position where we feel that there's a sense of love and sex and life with it all wrapped together.
Well, that you said it so well. I mean, it really is. It is about life, right? And we remember the dark days and the darkness and the scariness, and to be able to now have discussions about joy and love and life, and that's motivating. That's why I've always done all of this. I've done this to make sure there's no disease and no death and no fear. And to hear now patients or real people taking these medicines for prevention say, I am living my life in a way that I never thought I could, that I never thought 20 years back, 30 years back I could. That's amazing, and it's a testament to all of those who were scared and who suffered and who died for the last 30 plus years, because all they wanted also was to live a happy life.
Right. I have had the opportunity to interview a few community who are much like yourself in the community, as well as being researchers, but are really invested in this sense of real life. And some of them are in bad areas that are, that in parts of the world that are just now thinking about scaling up and are fighting for their ability to get PrEP. So we're not there yet everywhere, but we're definitely on the way.
Yeah.
And this global, what you might call a global demonstration project, is really amazing because it's pulling the people and saying, this is irresponsible to not offer PrEP, especially in areas where it really has a high incident rate, where you can really make a difference, a high impact. So you can't do it everywhere, but my goodness, it would be nice if we could, but at least do it in the areas that are high incidence.
Right. There's still fight that has to be done, because there's places where treatment isn't fully scaled. Mm-hmm. There's places where access to harm reduction services or to safe places to access treatment or prevention aren't available. And then of course there are many places where PrEP isn't available now. But we take all of the learnings from different places where treatment is saving people's lives and opening up their lives in new ways, where treatment and PrEP and other strategies together are allowing people to conceive children in a way that is freeing and safe, to be able to have new types of relationships where status neutral relationships, where people are in treatment, where people are in PrEP, and people look at each other in different ways, and where new infections are decreasing. And we say, if it can happen there, it can happen in this other place, and it can happen in this other place. One of the great things about this meeting is hearing about where infections are starting to fall. And I'm from the United States and from Seattle, and we are in the United States in some places maybe getting hints of new infections falling, but the information here is on places like Sydney and London, where infections are falling. And so we all need to be learning from each other and competing a bit against each other to be able to have the most impact we can as quickly as we can.
Can you give a little background? I want to make sure that people understand where you come from, of the work that you did over the years, and where you began and in professionally in science and so forth.
So I'm from the U.S. I've done HIV prevention work my whole career for 20 years now, a little bit over 20 years now, and almost all of it in Eastern and Southern Africa. Although I live in Seattle, and I worked on PrEP. I ran Partners PrEP study, which is one of the, along with IPREX, the two trials that proved that PrEP worked for HIV prevention. And in most recent years, I've been doing a lot of work to scale up PrEP and to develop new strategies like the Dapivirine ring for prevention. And I thought about HIV risk my whole life because I grew up in the late 80s and early 90s in the US.
Well, I'm so appreciative of the work you do, and you've been a champion for certainly for letting people know what is happening, because you've been on many panels over the years at CROI and here. But it's nice to talk more broadly and more how we're absorbing what we're learning and how we're using it in the community, because that's, if it doesn't get used, and that's one of the biggest challenges we have with PrEP all the way.
Right.
Is implementing it and saying, look, this is real, this is working, let's implement it.
Right. But let's make it accessible to people, because I think people know what to do when we've got tools that will work for them.
Thank you very much, Jerry.
Thanks,
appreciate
Brett.
it.